Thank you so very much, Chair Brown. It's been 14 years since the passage of the Affordable Care Act, yet 10 states, including Georgia, have not fully expanded Medicaid. Let me be clear, closing the health care gap is the right thing to do, but it's also the smart thing to do. It's good for our economy. In fact, a recent report from the Council of Economic Advisors concluded that Medicaid expansion increases the disposable income of those gaining health coverage. And for those who are listening and watching, I want to be clear that when we say expansion, we're not talking about a new program. We're not talking about spending additional dollars. We're talking about the fact that citizens in states like Georgia don't have access, that they're subsidizing healthcare in other states while their hospitals are closing. But the Council of Economic Advisors pulls into sharp focus the importance of this, the ways in which we can allow hardworking families to spend less on healthcare and more more on essentials like food, diapers, and school supplies. Secretary Yellen, thank you so much for being here. Can you discuss how state economies have improved post-expansion, specifically compared to non-expansion states like Georgia? Here's what we do know about closing Medicaid coverage gap in Georgia. If we were to close that Medicaid coverage gap in Georgia, it would mean $1.2 billion in additional federal support that I secured through the American Rescue Plan Act. That money sitting on the table, 600,000 Georgians in the Medicaid gap. It would mean 56,000 new jobs every year, with 12,000 of those in rural communities. And it would mean $6.5 billion per year generated in economic output. And so I'm hopeful, I remain hopeful that Georgia lawmakers will do the right thing for Georgians and close the health care coverage gap